So to increase internal rotation, a lot of times I'll do this one here. Hold, don't let me, and I'm lifting my forearm up. And again, about 6 seconds, and then relax. And I'll kind of shake. And I'll take up the slack and hold it again. And relax. And do several of those, right? And then after I do that, I may do a few of these just to get you loose again. Okay. I used to do some strain counter strain with some teres, you know, minor or major back here. If you want, just do some soft tissue work back through here. If you feel like there's any knots or anything you need to, or you want to work on. Again, the more soft tissue work you do, the more soft tissue work you're going to have to do. Yeah. Right? So you want to do as little as possible that still helps the patient get better. Right? Sometimes if you really think that scapula is stuck, you'll come in here, you're going to push kind of posterior and inferior. You're going to use the medial border of your first digit, your finger, maybe even kind of side of the tip, and get underneath. If you think they're really stuck, you can get it and kind of pull on it. Sometimes I'll tell them, squeeze out my fingers. Squeeze them, good, and relax. Go loose again. And squeeze them out. Good, relax. And squeeze them out. Squeeze them. Okay, good. Excuse me. Okay, since we're already on the side, let's do some IT band. Let's just skip right down to it. Okay. If I'll give them a pillow or a blanket between the two, right here, just because I'm gonna push. I don't want to hurt them. I'm using my Thenar Eminence. I'm putting a fair amount of pressure, right? And I'll probably do 20 or 30 of these. If I've evaluated a patient, and I'll kind of make a list of what I want done, right? But this could be one if I'm working on the hip. It could be one if I'm working on the back, possibly. Mostly it's going to be if I'm working a knee. But you'll feel on the first couple, three, you'll feel a little speed bump or a little bump somewhere. Usually it's a tender, painful bump, but that's some just tissue restriction, adhesions. And we're just trying to loosen up the connection between all these layers, between the fascia and the IT band and the muscle. We're never stretching the IT band. It's got the tensile strength of steel. It does not stretch. When we stretch the IT band, we're stretching the connections where it makes on the tibia and the connections it makes up on the pelvis. In those areas, those are stretchable, but the actual IT band is not really stretchable. You know, if you find a bump, which I don't even really feel on him, you can stay on it for, I don't know, a minute if you want. Try to loosen it up. Okay. I'm just thinking of other side lying